You know, sometimes the biggest revolutions happen quietly. And that's exactly what's been going on inside Turkey's public health system. It's a massive digital transformation, one that took a wasteful, kind of clunky process for buying medical supplies and turned it into a powerhouse of modern efficiency. So let's dive into how they actually did it.
It all kicks off with this one single number, 220. Before this whole new system, that's how long, on average, medical supplies were just sitting in the warehouses of Turkey's public hospitals. We're talking nearly 8 months of vital stock just collecting dust on a shelf.
I mean, the scale of this change is just staggering. They went from that 220-day nightmare all the way down to a lean, totally manageable 80 to 90 days. So the big question is, how on earth did they pull that off? Well, to really get the solution, we've got to understand the problem first. Okay, so this 220-day problem, as we're calling it, it was way more than just a logistical headache. No, this was a full-blown systemic crisis, and it had some really serious consequences. So, what really happens when a health system buys way more than it needs? Well, you get massive financial waste, for one, and just unbelievable logistical nightmares. And then, of course, the pandemic hit. And that just-in-case panic buying, it just poured gasoline on the fire. But here's the real kicker. The official goal was only 60 days of stock. That enormous gap between their goal and the 220-day reality was proof of a deeply, fundamentally broken system. So how do you fix a problem that big? Well, the answer was digital. They built a procurement platform called the Health Market, designed from the ground up to put an end to all this waste. Let's take a look at how this whole thing came to be.
Now, this thing didn't just pop up overnight. The idea started kicking around back in 2018, a really key agreement got signed in 2019, and then in 2020, they rolled it out across the entire country. And get this, it was tested under the most intense conditions you can imagine, right in the middle of a global pandemic. I mean, talk about a trial by fire, right?
And look, the whole point of this new system wasn't just about buying stuff cheaper. It was about buying stuff smarter. The entire platform was built on 3 core pillars: tracking data in real time, having absolutely uncompromising quality control, and delivering financial savings that you could actually see. And the results? Oh, they are striking. The system is on track to save 1.5 billion Turkish lira in just the first 6 months of 2025. And that incredible number comes just from cutting down on all that unnecessary stock. Wow. But, you know, this whole revolution wasn't just about saving money or being more efficient. As important as all that is, there was something even more critical at stake: patient safety. The system brought in a super strict quality control process to weed out any shoddy products before they could even get near a hospital. So how does this quality filter actually work? It's pretty straightforward, but man, is it effective. First, a supplier applies to get their product in the system. Then, a sample gets called in for testing. It goes through some super rigorous lab analysis, and only, and I mean only if it passes every single test with flying colors, does it get the green light. It's a simple but really powerful gatekeeper.
And you can really see the results. I mean, check this out. Because of this pre-screening, more than 1,400 products that just weren't up to snuff were stopped in their tracks. And the stuff that did get delivered to hospitals, a 99.3% inspection success rate. That is, well, that's pretty darn close to perfect.
Of course, a massive change like this, it's never going to be a perfect story for everyone involved. So to get the whole picture, we really need to hear from the folks in the medical device sector. You know, the good, the bad, and the complicated parts of this new system. Let's start with the good stuff. Industry leaders? They absolutely love the transparency. They know what's happening, and the payments are predictable. And for any business, taking the guesswork and uncertainty out of the equation is a huge win. But right on the heels of that praise comes a pretty stark warning. This quote is a powerful reminder that this entire supply chain is a delicate ecosystem. It's all connected. If one part breaks, the whole thing is in trouble. So what are their biggest worries? Well, for one, there's intense pressure on prices because of this big centralized buying system. They're also getting squeezed by all the global chaos, supply chain nightmares, not to mention that most companies just don't have the cash to keep huge amounts of inventory on hand. And here's a big one. They argue it can stifle innovation, making it really tough to introduce newer, more advanced, and more expensive products. In all this tension, it's kicked off a really important debate about what's next for the system. How do you balance the incredible efficiency of a central system with the need to support local economies?
Could some kind of hybrid model actually be the answer?
It really comes down to two different philosophies. On one hand, you have the current centralized model. Its goal is simple: use the whole country's buying power to drive down costs and keep standards high. But on the other hand, you have this idea for a more local model, which is all about steering that health spending back into local businesses to boost their economies from the ground up.
And this isn't just some vague idea. There's a concrete proposal on the table, a 60-40 split. The idea here is to completely transform the health budget. It wouldn't just be for paying for treatments, it would become an actual economic engine for local cities and regions, all while hopefully improving service quality right where people live. But believe it or not, the story doesn't even end there. The vision for this system is now going global, which leads to a pretty wild and ambitious question. Could Turkey's solution become its next major export?
The concept has a name: Health Management as a Service. And it's pretty much what it sounds like. The idea is to package up the entire system, the purchasing, the logistics, the quality control, all of it, and sell it as a ready-to-go, turnkey solution for other countries. It's essentially offering a blueprint for how to build an efficient, reliable medical supply chain.
So, a journey that started as a fix for a huge domestic inventory problem now has the potential to become a global model. This leaves us with one last, really fascinating question to think about. Can a public system born out of a crisis truly become a country's next major export success story?